My son Jimmy had an overbite and he had a very shallow chin, so we chose to proceed with a two-phase treatment for him. He was older, he was 14 or 15, and he was nervous, I think, about the peer response that he was going to get. And I remember having conversations with him, you will thank me later and you will be so pleased that we did this. And my daughter Grace also is now currently in the midst of phase 1 of a two-phase treatment. She as well has an overbite and some crowding that we're trying to correct, and we are waiting to see if she will need braces. So it's exciting to be able to experience that anticipation to see if that phase 1 treatment is going to be enough. It seems that retainers these days are a status symbol, and so she just couldn't wait to be like her friends and, Mom, when am I going to get my retainer? I can't wait, and knew the day and knew the date and was counting days, and she's just very excited about her treatment, and we are eager to see what phase 1 brings. From the very beginning of the process, the initial consultation, on through working through the financial aspect of the treatment, and of course all the follow-up visits, the staff has treated us with the utmost care and professionalism. We are so pleased with the office, physically, and the staff. The office is absolutely state-of-the-art, and the staff is so caring. We would go nowhere else. We're very pleased.
At the Center for TMJ and Sleep Disorders, we provide early orthodontic treatment to prevent extraction of permanent teeth.
Well, I started out with really bad pain in my jaw area, and it would give me headaches every day, and I couldn't really eat anything.
In the back of my mind, always thought about having my teeth straightened, especially since as a child they were straightened, and unfortunately because of follow-up work that wasn't performed, they became very crooked again, actually more crooked because I had teeth extracted than they had originally been. So for years and years I've considered having it done. Finally it became a financial option. I just thought how great it would be to have some of the issues, the super crowding of the bottom teeth and the teeth that were sort of protruding out top, just to be straightened again. So I felt good thinking about it, and I decided to pursue the records appointment that Dr. Tammy does, and actually was thoroughly impressed with what came out of that.
I originally decided to get braces because I just wasn't happy with my smile, and I was afraid to smile, and I just was very self-conscious about my teeth. So we decided to get braces, and I was very happy.
My youngest is 7, she's in retainers, and my oldest is 12 and she's in braces. Both of them had very narrow palates, very small mouths, so we had done the expansion, which is great.
At the end of 3rd grade, she started in the orthodontics program. When there wasn't enough room for her permanent teeth to come in, Dr. Tammy started her with the palate expander. We trusted Dr. Tammy in the fact that there was no room for her permanent teeth to come in. She was basically waiting a year and a half for one of her secondary teeth to come in, and it just couldn't come in. There was no room without making room.
Decided to have the orthodontics done, mostly for self-conscious reasons. And aesthetics. I was very self-conscious about my smile.
Being a senior in college, I really wasn't looking forward to having braces on for a 3rd time, but I'm glad I went through with the process, knowing that how much better I feel now, even having treatment for only a year. And I just know that in the future I'll feel better, and I won't have things like neck aches and migraines, and so far it's just really helped with the way I feel overall.
Some of the effects that I've seen from having my braces are that I'm more apt to smile, I'm more apt to talk to people.
Because of the work that Belichick and the team did on my teeth, I can go out with my friends and not have to worry about what I can or cannot order, or worry about the pain that I had.
My teeth were never really that bad, but I do remember for like picture day when I was in elementary school, I would smile and like my eye teeth would kind of stick down a little bit further, and I was always kind of self-conscious about that, so I'd try and smile differently to cover them up. But now I don't really have that problem.
That's why we use the retainers to expand the palates and open the mouth, make it wider for all the teeth to come in, and then put braces on just to guide everything into place.
This by far was one of the best choices I've ever made, especially to come here. Everybody's so wonderful. I'm so happy that I'm actually having it done. I'm already a year into the program, and next year they're going to be off, and the smile's going to be awesome, and it's never too late to have it done.
Like, I was really excited to get my braces off, but I was a little sad because it was almost like, especially with Bonnie and Jen, it was like they kind of became like my dentist friends, because they would always be the ones helping me out, putting different ties on and stuff like that. So it was kind of like, oh, I don't get to see them anymore. And then when I worked here, I really got to know everyone on more of a personal level, and they were all really nice. And then I went back to school, and I kind of missed them.
They cared more about my teeth, they cared about my life, and it was easy to come here because they're concerned about what's going on in my life, and I just think that's something that's unique and something that you won't find anywhere.
For an orthodontic evaluation or more information regarding our program, please call our office.